We have newly started a crash course in English for DHA, HAD, MOH, Prometric, NCLEX-RN, NHRA, and also for all government exams. This crash course is in Nursingflix lectures, which is available in Play Store. Hard sounds. Okay. You know that there are two hard sounds normally, lub sound and dub sound, lub dub. Okay. Also called as S1 sound and S2 sounds. Okay. What that particular S1 sound indicates means I already taught you that cardiac cycle. In cardiac cycle, I said atrial systole. Okay. After filling of the atrial chambers, there will be contraction of the atria that is called as atrial systole. Okay. Due to this contraction of the atria, blood will reach in ventricles. That time, which valves will be opened? Right atrioventricular valve and left atrioventricular valve. Simply, atrioventricular valves are opened. The blood will reach in ventricles. After reaching the ventricles, these valves will be closed. That sound is called as lub sound or S1 sound. Simply, S1 sound corresponds to closure of the atrioventricular valves. Don't forget that. It may ask as it is. Okay. And other thing is, after reaching the ventricles, ventricular systole occurs, contraction of the ventricles, blood will move to lungs and general circulation through the pulmonary artery and through the aorta. Which valves will be opened? Semilunar valves. That means pulmonary valve and aortic valve will be opened, and after moving the blood, it will be closed. That means closure of the semilunar valves, which is indicated by S2 sound. Okay. So that simple thing, S2 sound corresponds to closure of semilunar valves. Okay. Apart from that, there are some abnormal heart sounds like S3, S4. This is also called as gallop rhythm. It can be seen in some abnormal conditions like heart failure. Okay. Ventricular hypertrophy. See, SA node will initiate the electrical impulses. Through their branches, it will supply or transmit throughout the atrium. It is called as atrial depolarization. Atrial depolarization. It may take around 0.1 second, which will result in atrial systole. Clear? Then after that, from the SA node, electrical impulses reaches in AV node. From the AV node, it will transmitted through bundle of His, bundle branches and to the Purkinje fibers. It is called as ventricular depolarization. Okay, ventricular depolarization. It may take around 0.3 seconds, which will result in ventricular systole, contraction of the ventricles. Okay. After that, ventricular fibers, ventricular Purkinje fibers, branches and bundle of His and AV node. Okay. Which will get electrically stable as in the initial stage. How it will be? So same like it will be coming back. It is called as ventricular repolarization. Usually it may take 0.4 second. That is simply that is called as, that may result in ventricular diastole. Okay, ventricular diastole. Okay, I think you got the point. Okay, atrial depolarization, atrial systole. Ventricular depolarization is nothing but a ventricular systole, and ventricular repolarization is the diastole of the heart. Okay, so usually atrial diastole also will happen there, but during which time? Ventricular depolarization. It is dominating, ventricular depolarization, so that it will be hidden. It may not be seen in ECG. Usually we are using 5 waves, P, Q, R, S, T. These 5 waves are using to represent this electrical activity of the myocardium. Okay, one by one I will say. First, what I told, from the SA node, electrical impulses will spread through the myocardium of the atrium. What will be called as atrial depolarization, which can be represented by P wave. So this small notch is there now. This is called as P wave. So P wave indicates atrial depolarization. Then what else remaining? From the AV node, through the bundle of His and bundle branches and to the Purkinje fibers, electrical impulses spreads. That is called as ventricular depolarization. It is a long process, right? Comparatively. So it can be represented with three waves. Or otherwise, simply I can say it needs minimum three waves to represent. So that is QRS complex. Okay, it is called as QRS complex. So simply QRS complex represents or indicates ventricular depolarization. Okay, then what else? T wave is there. What is the story remaining there? Ventricular repolarization. Okay, the current status or voltage status of the ventricle will stable back. Okay, so that is called as ventricular repolarization, which is represented by T wave. Okay, so usually may not be seen, but there is a small elevation there, that is called as U wave. Usually may not be seen because this ventricular repolarization is very dominating. With that, the U wave cannot be seen in normal ECGs, and that is U wave indicates Purkinje fibers repolarization, or simply repolarization of the Purkinje fibers. But if it is coming very dominantly, okay, or otherwise simply we will call it as the same statement I will use, prominent U wave. Prominent U wave indicates, okay, prominent U waves indicates, or prominent U wave can be seen in hypokalemia. Okay, decreased potassium levels in blood. That is a very important ECG characteristic of hypokalemia. Can be asked. Okay. The rest of the things we will discuss in nursing foundation. Just it was connecting one. That's what I said. In hyperkalemia also, there will be peaked T wave. T wave will be peaked. It is a very important characteristic. It was a most common question they were asking. A tall peaked T wave is the characteristic of hyperkalemia, not hypokalemia. Hypokalemia, it is prominent U wave. Note it down.